Hi, I'm Diana. I'm one of the registered nurses here at Facial Plastic Surgery of Austin.
And hi, I'm Lia. I'm also one of the registered nurses here at Facial Plastic Surgery of Austin. And today we're going to answer a few questions that are most asked for some of our surgeries that we perform here.
What is the most important thing to prepare for surgery?
To prepare for your upcoming surgery, I would say the most important thing is avoiding anything that can thin your blood. This includes many supplements like fish oil, CoQ10, vitamin E, alcohol is a big one, and then of course green tea, which a lot of people don't actually think about thinning the blood. But it is very important to avoid all these things because going into surgery, you want to be at your best, and this will also help with your recovery and the bruising and the swelling and everything afterwards.
What is the downtime?
So for all of our procedures, we do ask that for 2 weeks you do not raise your heart rate. That does change with the deep plane extended facelift because it's a little more of a serious procedure. So we have a 2-4-8 rule, 2 weeks of no raising the heart rate, 4 weeks of no cardio. At week 4, you can start cardio again, and then 8 weeks of no heavy lifting, yoga, Pilates, anything that requires straining or stretching the neck.
How can I help reduce swelling?
After your procedure, to help reduce swelling, I would say avoid anything really salty. Salt makes you swell up more, and after the surgery, it will just be even more. So anything that is low in salt, high in protein, high in healthy fats would be best for your recovery to help nourish your body and help you heal faster.
How long does swelling typically last?
So typically after the surgery, we can expect this maximum amount of swelling per se to be around post-op day 3 to post-op day 5, usually plateaus until post-op day 7. From post-op day 7 to post-op day 14, most patients will experience a big decrease in their swelling, and after 2 weeks, we typically say that about 80% of the swelling is gone. The residual 20% of the swelling does take a few months and is a little bit slower to leave.
What are some of the most common questions you get?
Oh, this one's a fun one. I think one of the most common questions we get is how soon after surgery can you dye your hair? We say 6 weeks. We really just want to make sure that those incisions heal nicely before we introduce any hair dye near them or to them to irritate them. So we say 6 weeks for hair dye.
Another one of the questions that we get asked frequently is how long after my extended deep plane facelift can I drive? And the answer for that is 2 weeks. We say 2 weeks of no driving because we don't want you moving your neck or neck muscles at all. And so you can't check your blind spots, so you can't drive.
Thanks for joining us for a quick little Q&A session. If you have any questions, just send them our way and we'll be sure to answer them.
And hopefully we see you in the future.
Bye.
Bye.